And if you're not familiar with the premium pay program and that naming of it, I know we've discussed it before, but premium pay is called premium pay because that is what is allowable within the state fiscal recovery fund. And that's the funding mechanism that we have and we're provided for by the legislature. But this program is really to support retention and recruitment of healthcare professionals. And that was what we proposed. And it is called premium pay because that is the avenue by which we can support. So we wanted to provide an update on that program because we have recently gone through the process with the Joint Fiscal Committee to add provider types for a second round of the program. And really, it shouldn't be called necessarily a second round because this second phase of the program will be open to these new provider types, but it will be closed to the provider types that have already availed themselves of the grant opportunity. And there has been, I think we've shared with this group that there's been very good response to that opportunity and a high degree of uptake. And Wendy and team have been leading on the program. And Wendy, is there anything that I should say about the first round now that would be helpful context?
No, I think we're just, as we're working on part 2, or round 2, we are trying to get that application portal open as quickly as possible. That requires some systems changes that can be sort of time intensive. So we're really trying to narrow that time period as much as possible. And I think we're hoping that we could get out and do some education of providers in advance of opening that grant application portal, because as those who've participated in some of our other programs, some of the most time intensive part of the application is often filling out the spreadsheet. The spreadsheet is what helps us calculate the number of full-time equivalents, which is the basis of the grant award. So I think that's what we'll be coming out with first, is educational materials, and we'll be happy to receive any feedback that could help us really improve that so that we can start getting these round $2 out as soon as possible.
And a quick recap of the program on the whole, there were $60 million that were allocated for recruitment and retention activities, with 45 million indicated for the first round, which Wendy's referencing. And there were a number of eligible provider types that were established by the legislature for that first opportunity. And within that 45 million, approximately, I think 33 million has been awarded or is in the process of being awarded for the applicants to the program. So there are remaining funds there, but also the original intent was to withhold 15 million for this second round of opportunity, unless it was the case that there were so many applicants in the first round that it consumed all $60 million. So in the second, and then the way the legislation also worked was that for that second phase or opportunity, we would need to propose provider types to be eligible to the Joint Fiscal Committee, which we did last week. And those new eligible provider types are primary care, dentists, private therapeutic community residences, those therapeutic community residences that are independently owned and operated and that are not a part of the designated agency system, because there were therapeutic residences that were funded in the first round that were part of the designated agency system. So we wanted to ensure parity for those that are outside the system being eligible in the second phase, and high-tech nursing, high-tech nurses that were ineligible in the first phase if they were independent of a home health agency. Those high-tech nursing that is included or part of home health was also included in round one. So those independent home-based high-tech nursing providers are now included for the second round. So again, we're working on, there has to be a significant amount of retooling of the system for this second round and these provider types. And as Wendy said, we do want to emphasize outreach and education about the application and process in advance, so that providers and can be successful in the application process, which I think it is a testament to how the program was run in the first phase, that there was very high uptake of applicants, and we think we had, like, you know, good saturation among those who were eligible actually applying and going through the process. And I think that's a testament to a lot of the upfront education and outreach that was conducted in advance.
Ina, hi, this is Devin. I'm sorry, Can you tell me how you chose those providers?
Yes, we heard we heard indication through both this feedback from this group in previous meetings, as well as hearing about primary care through the healthcare reform work group that was focused on near-term stability. And then in the case of those independent high-tech nursing providers and independent therapeutic community residences, there wasn't parity for those independent providers relative to those that were affiliated with designated agencies or home health agencies in the first round. So the real intent with their inclusion here is to provide that same opportunity as was provided for those that were affiliated with an organization that was eligible in the first round.
You know, this is Becky Capsalis. I don't know if you can see my hand raised in your view, but I often worry, you know, hearing of this initiative and being part of this group. I get that we are advisors, but there is this like nagging worry that I have of, am I also supposed to be making sure that those who need to know this information know it? So, you know, home health and hospice is part of the UVM health network. We have primary care, we have dentists. I want to make sure that if there is something that is being expected of me, or Betsy is on this call too, in terms of like spreading this information, that's clear to me. My understanding, I think, is that is not the expectation of us, that there is outreach happening that we are not accountable for, Betsy and myself. But if I am wrong, please let me know.
Thank you for that question. You are not wrong, but your participation in this group doesn't make you accountable for disseminating all of the information about the workforce development activities. Certainly, being an ambassador is welcome. If you know about things and you can share those things, that is very welcome. I think we did the direct outreach to the providers that were eligible in the first round. For example, there was a lot of outreach to those providers through different channels that I think were direct to them, and then raising their awareness of the program. And again, I think we saw a really high percentage of eligible providers apply and be successful. So by all means, amplifying that these opportunities exist would certainly be a welcome role for you to play, but it is not an expectation, and this information is certainly getting out to the eligible provider types in other channels. we
And I
are
will
not
just-
relying on you to do it. Go ahead, Wendy.
I will just add that what I think was really efficient about the last round is these were known providers from the Agency of Human Services. So I actually had provider lists. So we did a lot of outreach directly to key contacts in those organizations. So a next step will be figuring out how to do that with these provider types. So if anyone has feedback on what is the best way to reach all of these provider types, I would very much value that. That is the next steps that we have on our list.
I
You know,
see
this is,
Jill.
yeah, oh,
Yeah.
I wasn't sure if you could see my hand. Thanks, sorry, I don't have my video on, I'm traveling and I just don't think I have the internet. You may have said this, I came on a little bit late. So in the next round, is it only open to those new provider types or is it also open for extension for the existing provider types?
The next round is only open to these new provider types.
The current legislation has it capped at the awards at 2,000 per full-time equivalent. And so really there's not, because we had such high uptake, we've really done a good job at maximizing the funds for those eligible providers in the first round.
Oh yeah, no, we really appreciate it. We're just concerned about needing to do it, to keep doing it in order to keep people employed. So, you know, the retention pressures have not really let up very much, or they've probably gotten worse.
Well, we do have this second round, and we also have to reconcile and complete the first round. We will then evaluate at the conclusion of the second round what there may be funds that remain, and at that point we would need to potentially propose something for those funds going forward if there are remaining funds. We do have to reconcile the round of funding that's already been issued, as well as see where we land after round 2. But I think it's possible that there will be additional funds remaining and that we would recommend investing those funds in workforce development activities, potentially activities that are already established today, but where the funding may not be particularly robust.
Okay. Thanks.
So, just so I'm clear, the grant is only for those new professional services. I'm a little dismayed. I guess I'd be curious how, like, we have a terrible capacity crisis right now, right? Like, we have more people in our emergency departments than ever. It's not just mental health people, it's people with acute health needs. And a lot of that is due to our subacute population and a general surge. I'm just curious, how will this help us? I can understand how primary care would help us in the long term in terms of we want to keep our primary care people here, but how will this funding help in the immediate short term to ensure that our healthcare system doesn't collapse?
Well, I think that this is one component of funding, and certainly that there are other pieces that were and that could be provided for in terms of stabilization. Certainly that was a key topic in the healthcare reforms, short-term stability work group that convened over the summer and created some recommendations that I think are really very much directed in terms of hospital capacity. So I think those strategies are also really imperative at this juncture, given we do understand those pressures. So there are other strategies that also may be more that may be more appropriate to meet the need than the program here, which is a $2,000 per FTE award for retention.
Thank you.
So are there any more questions on this topic? Okay, and I don't think I'm seeing any. We have the next agenda topic is a synthesis of feedback on the healthcare employer nursing pipeline and apprenticeship program. I think through this group there was some feedback that was already provided on that program, and also Marianne has shared with me some feedback that she's gathered specifically from the hospitals and what would be helpful for hospitals that may participate in a program of this kind. If I could, I'd like to turn it over to Wendy first to talk through or just do a high-level overview of the feedback we received through the direct information gathering that we did, and then hear from Marianne about what she's gathered in terms of feedback, because I think we want to be strategic relative to this feedback and relative to the funding source that we have for this programming. So first, hearing what would be important for employers in being able to offer a program of this kind.
I don't want to be too repetitive from our last meeting, so I'll do this fairly quickly. Previously, we had 8 responses to a survey. We now have 10, but we are seeking to bring on a contractor to really help us and implement this program. So I think there's still continued time to be able to provide those responses to ensure it really assists us in program design. So we've heard even more provider types that respondents think should be eligible for this program, which aligns with the programmatic, the flexibility around a broad group of healthcare employers. But that's been validating to know there's probably many different provider types interested. We did hear a number of challenges around resourcing for running apprenticeship programs, insufficient nurse educators and nursing program slots, and challenges with participating financially for some provider types, which is a requirement of the program. Areas where respondents indicated they could benefit from state support and coordination. We had previously heard about centralization to help manage programs across the state, or funding for on-site coordination of the program. But in terms of program administration, we also heard interest in financial support to initiate and maintain a nursing residency program. That's one of our new responses. Also, one of our newer responses was around increasing programming in high school. So really getting people started thinking about these opportunities earlier. Turn that back to Ina. Really continue to welcome as much and more responses as possible to help us make this program better.
Thanks, Wendy. And as Wendy mentioned, we're in the process of contracting with technical assistance to make this program available. We again also heard feedback from Marianne, which I think, Marianne, it would be helpful if you wanted to share with the group what you've heard in terms of where a program like this could have particular impact, and then just kind of talk a little bit about that relative and the legislative intent, and how we do need to be strategic, which is part of why we're working with a contractor to be able to meet the requirements of SFR and the restrictions of SFR, while also trying to, again, meet the intent for this program.
So for those of you who don't know me, I'm Marianne Sheehan. I work for the Vermont Business Roundtable. I'm working for the next 3 years on a program called the Nursing Apprenticeship Pipeline. It's funded by a federal grant through Senator Leahy's office in part, and it works really nicely with this matching dollars that are coming up from the legislature. If having talked to Central Vermont Medical Center, UVM Medical Center, and Rutland Regional about what their needs are, and that's only 3 hospitals. But the things that I've heard so far are they would like to see the money used for paid release time for education, because students who are in this apprenticeship program might be spending about 20 hours per week in class time. So that would be release time. In-house practicing nurse clinical education preparation. So for people who are putting up clinical educators in order to expand the number of people who can go through the pipeline, we need more clinical educators in-house. And so those people have to meet accreditation requirements. So being able to prepare them would be really helpful. We have a loan repayment model that goes with this that reduces the cost to everybody who is participating in it. But the loan repayment model would be managed through VSAC, and they can see that it's a recycled loan. So what they would like to see is seed funding for the people who are actually using the loan repayment model in order. This is like a summary that probably needs a bigger discussion, but I'm just going to say seed funding the initial cost of a loan repayment. And then wraparound services for people who don't qualify for VSAC services. They have a TRIO program called the Education Opportunity Center, which is really a wraparound for people who are first gen, have no degree, and need a lot of assistance in applying for loans and grants and things that are out there. And then academic tutoring support and mentorship for people who do precepting. Wraparound services for outreach programs so that we can enhance the qualifications of individuals who increase diversity, equity, and inclusion. So those were some of the things that came up. You know, and in addition to any other wraparound services, which we sort of took off the table, but those were the more specifically what we came up with. And if Betsy, if you have anything to add to that, you and I have talked about this extensively, but I'm just wondering, you know, did I get everything?
Yeah.
Yeah.
Yeah, you've got everything. I would stress that the clinical faculty, I think, is really one of the barriers. And I think it would be great if we could develop joint appointments or other partnerships where those are, you know, our staff that are managing our pipeline cohorts, which is how we're going to manage it here at UVM-MC for our pilot group. But I think that would just be important for other hospitals to take into consideration.
Thank you. Thank you for sharing that feedback. And again, we hear the importance of the wraparound support just generally, and think that that's something that we, again, want to be strategic about whether and how we can meet that need with the fund source available to us. So that's some of the work that we'll be doing. I want to say that the fund source available to us has a few routes that you can take that really do match with the restrictions that are applied in the fund with the fund source. And also the fund source is really closely tied to the public health emergency, which is a further restriction in terms of when and how those funds are used and how they're drawn down relative to the period of time where someone or where there was work performed during the public health emergency. So while we know that the fund source could be used, for example, to offset tuition, that is a clear use. We also have other programs that have been supported through Act 183 that are available for persons to receive tuition scholarships or forgivable loans. So we want to be cognizant too of not being only able to use this fund source to kind of replicate something that's already going on in another place. So those are the sort of constraints that we're working within. And again, we're looking at this strategically and really trying to figure out how we can make the program match with the needs of the employers and really promote appropriate pipeline and apprenticeship program that goes beyond, for example, just tuition assistance. We hear that that is definitely a more broad need for the employers that would be participating.
This is Jill. I guess, Marianne, is your program limited only to hospitals? Is that the only nurse employer you're considering in your program?
No, it's not. However, I'll just say that because you need to put up cooperative clinical educators in order to make it happen, I think there's some limitations on who actually are best to do that.
Yeah, so I think that, I hope that you'll take that into consideration as you think about how this program should work. I think you've heard from my members for sure that in order to bring nurses into the home health sphere, we have to do a heck of a lot of training in the field that we don't get paid for. So we have to actually send out nurses with supervisors and with additional nursing staff. So I hope Johanna, I know she's not on the call, has shared with you the residency program that she does. And Marianne, I hope you'll look at that.
Sure.
But if we don't get, we got to get support to other organizations other than hospitals. It's really important to help hospitals, but we're losing nurses to hospitals every day, and because they're paying more. So we really need to think about the whole system. And I get very concerned when I hear about things that are only targeting one employer of nurses.
Yeah, and certainly this program is not, it's not targeted for any one employer. It's encompassing of all the employer types. The one that we're talking about framed by Act 183. Laura.
Thanks. I just wanted to.
Sorry, Laura, just for those of you that joined late, I have a computer issue so that my screen broke. So that's why I'm sorry if I'm not seeing your hand easily. I'm trying to do a lot of things on one screen that I don't usually do on one screen.
It's okay. If you had totally ignored me, I would have jumped in. Don't worry. For those of you who know me, I don't sit quietly. But just with respect to both Marianne's program and the pieces you're talking about, I just want to echo Jill's sentiment. And, we have identified nurse leaders in the skilled nursing facilities in particular that can meet the requirements for nurse educators with master's degrees. We have some with PhDs and others, but I also want to make sure we're thinking about how to do this in our other long-term care facilities, our residential care homes and assisted living as well. So if we can find a way to try to make those connections, I can tell you, and I've just been experiencing this with a number of skilled nursing facilities this week. I mean, their nurses are jumping ship and going to hospitals. Just the pay is better. So we've got to do something to encourage, a real desire to work in long-term care settings and post-acute settings.
Yeah. Well, and if I can just add, this is Jill. Marianne, are you reaching out to home health agencies? I'm struggling to I keep losing the plot. There are so many different initiatives. And I don't know if we've ever come up with I think we had talked about a spreadsheet or a grid or something so we can track what's happening, because I'm struggling to support my members and to tell them about all the things that are happening. And then so I get on this call and then I start to feel like, oh my goodness, I'm not really supporting them the way I need to, because I don't know about this program, Marianne. This is the first I've heard of it. So I don't know if you're reaching out to members. I don't know if they know about it. Maybe I should have reached out to them, but this is my first pass at this. So I just need some help as a very small association, keeping track of all that's happening.
Yeah, I'm happy to meet with you offline if you want, for both of you guys, because we've worked together for kind of a long time, and this grant actually just went through February 1st. So November 1st. So we've been waiting for a really long time to see it happen. But now that it has, it's really kind of geographically based. The more opportunities are in southern part of the state, but we can talk about it offline. When I say opportunities, it's because of the limitations of Vermont Tech. So.
Mm-hmm. Okay, great. Oh, I'd love to do that. And I guess Ina and Wendy, I'd ask you guys, or I'm not sure, maybe Abby, if, is there, is there a document that sort of tracks all the things that we're focused on in this group, so that I'm having members asking me for summaries, and I just don't know all that's happening. I'm really struggling to track it all.
Yeah, we do have a document, and actually that it is related to the item 6 on our agenda, information gathering.
Sorry.
But I will say that Mary Ann's program is not a part of what we have in our document, because our document, or the document, is really based on the workforce development strategic plan and the things that were put forward there. And then of course, some of those things materialized in Act 183, some of them, exactly as were provided for in the plan. Some of them are iteration of what the plan considered. Some of them, I think, helpfully are actually evolved from the plan and are more fully formed than what the plan had discussed and what the plan had kind of put in, more suggested a process around versus an actual funding stream. So yes, we do want to be able to keep the group up to date on where things are relative to the plan, but we also are concerned that we might be missing things, like that the plan there's a lot in the plan. It's a huge plan, as you know, and you're familiar, but it was also written, prior to, like, the workforce shortages are even more extreme now, and the impact across the system is much more extreme now. And I think that the need for short-term solutions is greater than we anticipate. Certainly the plan has some short-term solutions, but I think that's something we wanted to gather more information about. Like, are we missing, and should we be promoting some shorter term solutions that we're not promoting?
Okay, awesome, thanks. Yeah, I don't seem to actually have the agenda. It's funny, I have a lot of attachments for this meeting, but not the agenda. Quite possible I just deleted it by accident, but.
I'm sorry about that.
Oh my goodness, it's too many emails.
I know the feeling. I know that feeling very well. Now, the next agenda item is to go back to an item that we discussed as a group last time. And this is a great example of something that is not in the Workforce Development Strategic Plan, but that has come forward and might be something that we want to see continued to fruition, which is student licensure. Talked about it. Betsy brought this forward in the last meeting, and I think she has more information to bring forward today. But for those that weren't there for the discussion, the very basic summary is that if advanced students can be licensed, then those students can perform tasks independently without certain tasks, a scope of tasks that is appropriate to perform independently and without direct supervision, which could certainly in the near term help to alleviate some of the workforce pressures by having more persons in the workplace able to perform tasks independently. Also, like, I'm not qualified to say how much it's important for the professional development and the pipeline, and I'll pass it over to Betsy now to say much better what I tried to describe about the program.
Thanks, Ina. So this came from a program out of the Alabama Board of Nursing in partnership with their hospital association, as well as their apprenticeship board. And actually, I just saw that Michigan has implemented a similar program, and Maryland has a program like this for their LPNs. And so essentially what it is a true apprenticeship program in the sense that a nursing student is working one-on-one with a designated mentor to gain clinical competence. Alabama is working with about 48 different employers. They're working with 11 different educational programs that are accredited by CCNE and ASIN. They have issued about 80 student permits to do this work, and they're just seeing it rapidly take off amongst their workforce and employers. And so in order for Vermont to implement a program like this, we would require statutory change as well as a rule change. This is actually really great timing in the sense that the administrative rules for nursing are out for public comment right now through December. So this would be a way that we could implement the language within our administrative rules and statutes to support the possibility of a program like this. And I would really urge this group to consider it. Speaking to Laura and Jill's needs, I think this would be a great pilot program for long-term care and home health. There are additional changes within the administrative rules that also release some of those prescriptive clinical requirements for academic programs. So there may be even more flexibility in working with our academic partners on how we structure that clinical time. These nurses still need to be able to pass their NCLEX, so they will be required to meet, the minimum standards for things like labor and delivery and psychiatry. But there's a way that we could develop partnerships amongst hospitals or places that have those clinical experiences to make sure that that's done. So, my comment really is to urge this group to support these changes to allow some flexibility as we innovate programs over the course of the next year or the next couple of years, and just have this be an option for us to create and expand the workforce. Jill?
But that's really helpful. I actually had been sort of wrestling with making sense of those changes. So I don't know if you have any comments on them. I would love to, if you have written comments, I'd love to see them, and it might help me formulate comments if that's helpful, if you think it's helpful for us to comment.
For the full
Yeah.
administration? Oh, yeah, I will send you my summary.
That would be great. Yeah,
Okay.
that would be super helpful. Thank you. Thank you for explaining it a little bit.
Yeah.
So I'm not sure I fully understand the changes, the statutory changes are at the federal level? Or no,
No,
they're
The Vermont statutes, yeah,
Vermont.
the Vermont
Okay.
Nurse Practice Act, yep. And all it would be really doing is allowing the Board of Nursing to develop the permitting process and program to allow students to do this. And then the administrative rules would really outline the program.
Mhm. And is the act a yearly like,
No,
are there
the
yearly updates, or is this
No,
new?
so the last time they were reviewed, I think, was in 2015. These are fairly significant reviews and changes. Most of them gain a lot of efficiency and streamlining and make them easier, I think, for people to read and understand. But in doing so, they did remove a lot of sort of really prescriptive items that don't necessarily need to be within the administrative rules.
Thank you.
Mhm.
Any other discussion on the student licensure approach? And it sounds like it's permitting is actually the
Yeah,
appropriate
permitting.
term.
Yeah.
Jill, your hand is up, but I think it's an old hand.
Sorry. Yep. Old hand.
Okay. The next agenda item we have is an update on the preceptor working group, which is another requirement of Act 183, but I think is related to the Workforce Development Strategic Plan in that it asks that there be recommendations about creating efficiencies and a better precepting model on a statewide basis. So I would ask Laura if she could provide an update on the preceptor working group, because she's been doing the work to set up the working group. And I know that she's been in contact with a bunch of folks here about participants and representatives for that working group.
Yeah, so we've been successful in setting a first meeting. So the first meeting will be in early December. As Ina mentioned, it's really focused on looking at ways to expand clinical opportunities for nursing students and also explore sustainable funding models for nurse preceptors. So our first meeting will hopefully focus on the expanding clinical opportunities, and then we'll hopefully have at least 2 more meetings before January 15th, which was the date set in Act 183 for having some type of deliverable. So we'll be working on the action plan throughout the winter and hopefully developing some new strategies towards those goals.
And Laura, do you need any, I know that the legislation requires who representatives in the group. Do you need any representatives that are not yet defined for the group?
Yeah, so thank you for bringing that up. So right now we are absent a representative from the FQHCs and also a primary care representative. I know I've spoken to some of you about this, and Mary Kate Woolman has been working with me from Bi-State to try and get a representative from the FQHCs, but I think there's a bit of maybe workforce meeting fatigue, so we haven't been able to find any volunteers. So if anyone knows anyone who is affiliated with either of those groups that would be willing to participate, just shoot me an email and I can send out the meeting invite. And we're hoping to have additional meetings shortly after the first meeting. So even if they can't make the first meeting, which is on December 5th, I believe, we'd be happy to include them in further meetings. So yeah, so if there's any more participants that of, just please let me know.
Thank you. This is Stephanie from Bi-State, and I'll check back with Mary Kate to see if she's had any luck and see if we can shake the bushes a little further for you.
Thank you. That would be great.
And Laura, while you're ready, talking the next agenda item, the primary care survey.
Yeah.
And I'll just give a little context here before Laura talks in depth about this survey that is now out in the field, I believe. I think you're familiar that we, the Agency of Human Services, working with DFR and Green Mountain Care Board last year, looked at access to specialty services in the state of Vermont. We learned a lot during that work about also access issues for primary care. And although we weren't assessing access to primary care, we did name it as a next phase of work relative to overall access to healthcare services in Vermont system. And we're approaching this assessment of primary care differently than we approached the specialty care assessment, and Laura will talk about that. But we recognize certainly that there is a relationship between the workforce and access to these services. And so the survey tries to explore that as well as a number of other things. And I'll turn it back to Laura to talk about the survey.
Yeah, so yesterday I sent out an email to practice contacts for all of the Blueprint primary care patient-centered medical homes and asked them to follow a link to a Microsoft form that has a survey that talks about access to care and also workforce challenges that the practices themselves are facing. And so as Ina said, this is kind of a follow-up to the specialty work that was done last fall, but we've really tried to make this like a much lighter load on practices. So we're asking for just kind of estimated wait time. So is it, 1 to 2 months for an existing patient to get a wellness visit? Approximately what percentage of providers at your practice are accepting new patients, things like that. And I think it's been successfully designed to be easier. Microsoft Forms has this handy tool where it tells me it takes about 6 minutes for someone to complete it. We've already had several responses. I think we're at about 15. So if, I've had some discussions with different people about it who had expressed concerns, but if you hear anything from anyone about, worrying about the survey, it's really designed to be as simple as possible for people to complete and be an avenue for them to express their concerns, as well as to provide us with some information that we're looking for. Not all of the questions are required, so if there's just a few that they can answer, that's helpful for us as well. So we're looking to close the survey by December 15th. So there's several weeks for people to submit their responses, and then we'll look at the data and produce some reports that hopefully will be helpful for both the practices and for some, people within the state to look at the data.
Thanks, Laura. And again, Laura, emphasizing that we're certainly looking for information about, what would be helpful, what are critical concerns, and potentially through that information, learn about ideas or initiatives that really aren't in our workforce development strategic plan now, but maybe need to be, for example. So I think we're certainly trying to understand the current landscape very topically relative to what really is this very unprecedented workforce crisis, and gather that information to better adjust the kinds of initiatives that we might want to bring forward or promote as the legislative session takes shape as well. So relative to that, Laura's also working on another survey to gather information about workforce needs. And this one, I think we need feedback from this group about how that survey gets out to the right folks. And that's really maybe the most relevant to Rebecca's question early on, is like, am I the only, am I being accountable to make sure that this information gets out there to these provider types that could be eligible for assistance? And that answer is certainly being an ambassador of the information, but no, that responsibility doesn't fall to these work group members. But I think we are interested in exploring whether or not there's information that that you may have in your work that can be gathered, or if we need to gather some information more directly from providers individually, more akin to what Laura described in the primary care setting, but looking more broadly across the continuum. And I want Laura to describe what she's working on, but I think at a basic level, we kind of are we have two kind of areas of inquiry that we think would be important to gather information on, which is one, what do vacancies and turnover rates look like right now? And that's generally speaking. Laura's going to go into more depth there. And then the other area is relative to what Jill raised. There's a lot of initiatives that are active or were activated by Act 183 from the Workforce Development Strategic Plan. Here's a status update of where we are with those initiatives, but what's missing? Are there some key things that are missing? But I think, again, your guidance on how and who receives this survey would be helpful. And Laura, are there aspects of the survey that you think we should describe, that you want to describe now?
Yeah, so I mean, as Zena said, there's two sections of it really. One is about the strategic plan and brainstorming additional strategies that may not be in there. But another part of it is that we're trying to understand what data about the workforce is out there, and this has been kind of an ongoing piece of work for the last few years. And so we're asking you not necessarily to, report the data itself, but if you could tell us what types of data, or, direct us to the person who we know, like what types of data are being collected, like at your facility, like within your organization, things like that, like whether it's vacancy rates, turnover rates, things like that. We're curious about what types of data are being collected, if there are public reports that are available, if there's someone in your organization we could contact who could provide us with that data. It's sort of asking for an overview of what data is being collected and who we can contact about it, I would say is the most general area, because we're trying to figure out how we can gather more data to better understand the workforce in general.
So who do we report back to on that? Because I would be your person for the UVM Health Network to give you some insights around vacancy rate and turnover. So if anybody wants to reach out to me, I'm happy to have that discussion. We always struggle with getting good solid vacancy rates, because vacancy rates can be calculated on actuals or it can be calculated on budgeted. Like, we've still not completely honed in on exactly what measure of vacancy makes the right sense for us, but I can give general information around what positions we are having the hardest time filling, for instance.
That's really helpful, Rebecca. I think Laura's about to respond too, but consistent with how Laura described the primary care survey that she designed, I think the emphasis would be on making it easy to respond to, and providing for estimates would be appropriate, so that we can have a better sense, but not have, the idea is to gather information. And we know information gathering always has some burden to it, but to try to gather the information with the least possible burden, but to give us a better sense of where and what is happening.
Yeah, so probably would warrant a good conversation on the phone and in Teams meeting, just so I can kind of review what we have available and what might be most helpful.
This is Jill. Laura, many of the associations have tried to gather various data like these. We use it in our advocacy. It's really hard because we don't necessarily, I think as we were just hearing there's not consistent definitions about how people are measuring things. And then measures like vacancy rate, it's really sort of only good the day you measure it. It changes every time you hire somebody. So that's really a point in time measure. I could certainly share with you, if it's helpful, the kinds of things that we have gathered from members over time. But I also want to note that in the premium pay program, people are reporting data. So I'm concerned about the duplication, and I just want to, because we really want the information, but it does take time away from people's regular jobs, and people are pretty stressed. So, but anyway, I'd be glad to share with you what we normally collect, and if you're going to collect it, I won't collect it. So there's that too.
And I just note to Jill's point, I think the January reporting timeline will allow us to have more data relative to the premium pay program, where people are reporting on sort of vacancy rates. So that is a source that will be available in the next few months.
Yeah, and just to clarify, we are in this initial stage, we're just trying to understand what data is being collected and who is kind of the contact person for it. So it would be great to see these reports and collect further information, but we're still trying to essentially just figure out, so do you even have a process for collecting this data to begin with, just to kind of understand what it's reasonable at some point to ask for. And so this is an initial step. So I understand it's repetitious. I mean, both with the primary care survey and this, we understand that these questions are being asked in many forms, coming from many different channels. So we're trying to do this in a way that's as, less onerous as possible.
Laura.
Yeah, I'll just again, echoing, Jill and I kind of are the same person most of the time. But
Laura dresses better. Laura dresses way better. But other than
you speak about you're speaking far more articulately than I today. So yeah, the data collection is a challenge, and there are over 100 long-term care facilities. It's one of the biggest groups. We don't get good response rates, and it's this is one of the reasons why in our initial set of recommendations, for the healthcare workforce strategic plan, you know, the idea of having a state entity that's out there looking at this, I think is really important because it's just too heavy a lift for the associations. I'm not asking for the data right now in this respect because I just know it's a bad, terrible, awful, horrible situation and it's depressing and it gets worse every day. And I'm trying to get money from them on costs or money for surveys and, you know, data from them on what their costs are. You know, so they've got a lot of information requests coming and I just, you know, if you can get great responses, I applaud you. I just want to just kind of set some expectation management that it's not likely to be a robust response from long-term care facilities. Sadly, it's needed, but they don't have the capacity and they don't have a person that's sitting there able to like put data together and give it to us as we're kind of hounding them for a lot of things these days. So
Thanks, Laura. And we understand, we definitely understand that, which is why Laura was describing kind of the ask being like what is or isn't being collected so that we could then perhaps feed that information to the health workforce data center, which is
yeah,
something that will be stood up and that could be a starting place for, okay, like,
yeah, I'm just, yeah, and I'm just not collecting it anymore because it's just that bad. It's just that bad. So,
and I think it's also a good point about like whether the associations are, you know, are like a durable, like obligated to collect it, or if it should be coming in directly, right, through another mechanism, recognizing that recognizing the burden there too, as well of the direct submission. But I think that's what we're trying to think through.
yeah, and I think, you know, just thinking back to our long discussions about this topic last year, and maybe I'm misremembering, but I think certainly for small associations like Jill and I, like we don't have the capacity to do it. You know,
Right.
we don't have the people to dedicate to this, certainly in a way that keeps it
Right.
fresh.
Yeah. Yeah. And I think that's another, like how fresh it can really be, but maybe through like a centralized data center that it would be more standardized if, and you know, somewhat fresh. But I think there's a question too about like what's a reasonable expectation for reporting and how much and how often. I think we very much understand that probably anything is better than than our current condition. It would be like, it would be more information to work with. So I don't think we want to overburden. Stephanie, you've been waiting with your hand raised. I'm sorry.
No, that's okay. Some of this is clarifying, but I just want to say, like at Bi-State, we have a point in time where we probably from a few months ago where we asked about vacancies. We didn't ask about turnover rates, but we did ask about vacancies in their clinical and administrative in some specificity, but then a few general buckets. So we have a little bit of that information that's fairly current, and we asked them to project it for 2023. But, you know, like everyone's been talking about, the stuff changes every minute, you know. So I was just trying to get clear about, were you asking us as this group to say, what are you all collecting? Is the survey intended for us, or was the survey really intended to go to the ultimate and, you know, health center folks? And I don't know that I'm clear on it yet, and maybe there's not as much clarity. So is this intended, the survey, to ultimately go to the health center, you know, to the individual members of our organizations?
We first intended the survey for the members of the work group, of the advisory group. But I think where we were struggling is like recognizing that not all members of the advisory group have this data. So then like how we kind of structured the survey relative to that.
Thank you.
Yeah, I mean, I would say that even just having this conversation is helping me understand like how to kind of, you know, better target and kind of both the audience for the survey and the questions.
Okay. And like we're at time. But the last agenda item is, I can give you a really quick update here. And I apologize again with my screen, I can't see I can't see the clock. So with this last agenda item, we know that it's been identified by the group that there are new resources out there, particular and now I'm talking about resources directed for persons who are healthcare professionals or maybe healthcare professionals in training. And there's a whole host of additional resources that are available or will become available. And there's been interest in, okay, well, how do folks find these resources? So I think what we're going to do is work with a small team that includes some folks at VDH and AHEC to do an inventory of these resources, gather them all on a page, a web page, and then I think the key piece will be how to direct everyone to this web page. And I think that's where the work of this group would be really helpful, to be brainstorming where there need to be links. So is there a link from the bi-state page to this web page? Is there, we would definitely want to see like a link from OPR to the page because people are going there to get licensed, a link from Department of Labor to the page, but really driving people to a single web resource that would provide for, okay, if you're looking for loan repayment opportunities, here they are. Here's the list, federal and state, and then that would link to those resources. So that's a piece that I wanted to, I think we've determined that it's best to just get this project moving and devise the page probably to sit at the Agency of Human Services, Healthcare Reform, something along those lines. So that was the last bit to share, and I'm sorry we're over time. Thank you.
Before we get off though, wait, is there I'm sure you answered this. I don't know why I can't track it. Is there a chart of all of the initiatives in the development plan and their status? Is that a thing I can just see somewhere?
There is a chart of all the initiatives that it's in the plan itself, but that doesn't give you a lens into their status. And so when we send the survey to this work group, the chart will include an update on status. That is in the works.
Okay, so I'm looking for the survey, and the survey will, but will it be something I'm looking for something I can share? So
okay,
you know what I mean? Because this is the question I'm sure all of us are getting from our members, which is what were all the initiatives and where are they all? So it would be helpful to get it as a not embedded into the survey, but as its own thing. So especially because I know you guys are using SharePoint now, and you have these beautiful shared documents that can even be updated, and we can see them as they exist in the moment. Gotten a few of those.
We could probably make that happen, Jill. I have less of that expertise, but I think we could probably make it happen. I think if you've gotten SharePoint, there is a way to get outside entities onto SharePoint.
Angela Smith-Jang at Dale seems to know how. She did.
Okay.
Yeah.
Okay, so we'll see.
Yeah.
We'll see if we can make that happen for our group. We could definitely have, well, I won't go there now, but so what we're doing is we have an Excel document that Laura has put together so that we can update the progress on the areas in the plan. And we will include that in the survey, but I think we can also include we can also share the Excel document with you. Whether we can share it in real time with SharePoint so we can keep updating it together, we will have to explore and reach out to Angela about what her special powers are to make SharePoint available to state and non-state email addresses.
Cool. Even if it was static, it would be more than what I have now. So that would be great.
Yes, we are working on it.
Okay, awesome.
Okay. Thank you again. I hope everyone has a great holiday next week and has some time to rest.
Thank you. Take care.
Thanks. Bye-bye.